Methicillin-resistant Staphylococcus aureus, or MRSA, is a term that strikes fear into the hearts of many, and for good reason. This superbug is known for its resistance to many of the antibiotics traditionally used to treat bacterial infections. MRSA is not a new phenomenon, but has been a growing concern in both community and healthcare settings over the past few decades. The rise of MRSA has been attributed to the overuse and misuse of antibiotics, which has led to the development of antibiotic-resistant strains of bacteria. Infections caused by MRSA can range from mild skin conditions to more severe infections that can be life-threatening. Understanding MRSA is crucial for healthcare professionals and the general public alike to prevent its spread and manage its impact effectively. We will delve into the specifics of MRSA, looking at its symptoms, causes, and the types of infections it can cause. The goal is to provide a clear and informative guide that empowers readers with the knowledge needed to protect themselves and others from this formidable superbug. By the end of this essay, readers should have a well-rounded understanding of MRSA and feel better equipped to contribute to efforts in combating this public health threat. MRSA is a type of staph bacteria that has evolved to resist many antibiotics, making it particularly difficult to treat. Regular staph bacteria, known scientifically as Staphylococcus aureus, are commonly found on the skin or in the noses of healthy individuals. These bacteria are generally harmless unless they enter the body through cuts or abrasions, where they can cause infections.
However, MRSA is a strain of staph that has developed resistance to methicillin and other common antibiotics, posing a significant challenge to treatment efforts. The resistance of MRSA to antibiotics is due to genetic mutations that have occurred over time, often driven by the selective pressures of antibiotic use. This resistance is what earns MRSA the title of a superbug, as it can survive in environments where other bacteria cannot.
MRSA infections are particularly concerning in healthcare settings, where patients are often more vulnerable due to weakened immune systems or open wounds. However, MRSA is not confined to hospitals and can be found in community settings as well. Understanding the nature of MRSA and its resistance mechanisms is a critical step in developing effective treatment and prevention strategies. By understanding what makes MRSA different from regular staph bacteria, we can appreciate the importance of responsible antibiotic use and the need for ongoing research into new treatment options. The symptoms of MRSA can vary significantly depending on the site and severity of the infection. One of the most common manifestations of MRSA is on the skin, where it can cause red, swollen, and painful bumps that may resemble spider bites. These bumps can quickly become warm to the touch and may be filled with pus or other drainage.
If left untreated, these skin infections can worsen and spread to other areas of the body, leading to more severe health issues. In addition to skin infections, MRSA can cause a range of other symptoms that are indicative of its spread beyond the skin. In more severe cases, MRSA can lead to infections in the lungs, causing pneumonia, or in the bloodstream, leading to bacteremia. Symptoms of these more serious infections can include cough, shortness of breath, chest pain, and muscle or joint pain.
Early detection and treatment are crucial to preventing the spread of the infection and minimizing complications. Recognizing the signs of infection early can lead to prompt treatment and better outcomes. It also underscores the importance of seeking medical attention when experiencing unusual or persistent symptoms, particularly if they are accompanied by signs of infection or illness. The emergence of MRSA as a significant public health threat can be attributed to several causes and risk factors. One of the primary causes of MRSA is the overuse and misuse of antibiotics, which has accelerated the development of antibiotic-resistant bacteria. When antibiotics are used improperly, such as not completing a prescribed course or using them for viral infections, it creates an environment where bacteria can adapt and develop resistance.
Certain factors increase the risk of contracting MRSA. Hospitalization is one such factor, as MRSA is prevalent in healthcare settings where patients may have open wounds, invasive devices, or weakened immune systems. Furthermore, individuals involved in contact sports or who live in crowded or unsanitary conditions are more susceptible to MRSA infections due to frequent skin-to-skin contact and exposure to contaminated surfaces. Breaks in the skin, such as cuts, scrapes, or surgical sites, provide an entry point for MRSA bacteria.
Additionally, people with weakened immune systems, such as those with chronic illnesses or undergoing treatments like chemotherapy, are at higher risk for MRSA infections. By recognizing the situations and conditions that contribute to the spread of MRSA, individuals and healthcare providers can take proactive measures to reduce the risk of infection.
Section 5. Types of MRSA infections. MRSA infections are categorized into two main types: community-associated MRSA, or K-MRSA, and healthcare-associated MRSA, or HA-MRSA. Each type has distinct characteristics and patterns of transmission, which influence how they are managed and treated.
Community-associated MRSA, often referred to as KA-MRSA, often begins as a skin infection, such as a boil or abscess. It spreads through direct skin-to-skin contact, making it more common in settings where people are in close proximity, such as schools, gyms, and sports teams.
KA-MRSA is generally less resistant to antibiotics than HA-MRSA, which means it may be easier to treat.
On the other hand, healthcare-associated MRSA, or HA-MRSA, occurs in hospitals and other healthcare facilities.
HA-MRSA is often spread through contact with infected wounds or contaminated surfaces and equipment.
Both types of MRSA can lead to serious health complications if not addressed promptly. Understanding the differences between CA-MRSA and HA-MRSA is important for healthcare professionals in determining the most appropriate treatment and prevention strategies. Section 6. MRSA-related infections. MRSA is capable of causing a wide range of infections, each with its own set of challenges and potential complications.
The most common MRSA-related infections are skin and soft tissue infections, which can include boils, abscesses, and cellulitis. These infections can be painful and may require medical intervention to drain pus and reduce swelling.
Beyond the skin, MRSA can cause more serious infections in various parts of the body.
Pneumonia is one such infection where MRSA affects the lungs, leading to symptoms such as a persistent cough, fever, and difficulty breathing. In some cases, MRSA can enter the bloodstream, resulting in bacteremia, a condition that can rapidly become life-threatening if not treated promptly.
MRSA is also capable of infecting bones and joints, a condition known as osteomyelitis.
Additionally, MRSA can lead to endocarditis, an infection of the heart valves, which is a serious condition that can have lasting impacts on heart function. The variety of infections caused by MRSA underscores the importance of early detection and effective treatment.
Section 7. Treatment options for MRSA. Treating MRSA presents unique challenges due to its resistance to many common antibiotics.
However, there are several effective strategies that healthcare providers can employ to manage MRSA infections. The choice of treatment depends on the type and severity of the infection, as well as the patient's overall health.
For skin infections, treatment often begins with proper wound care. This includes draining any abscesses and cleaning the infected area to remove pus and bacteria.
However, more severe or widespread infections may require antibiotic therapy. While MRSA is resistant to many antibiotics, there are still several that can be effective, including vancomycin, linezolid, and daptomycin.
In addition to antibiotics, supportive care is an important aspect of MRSA treatment. By staying informed and vigilant, healthcare providers and patients can work together to manage MRSA and reduce its impact on public health. Section 8. Prevention strategies for MRSA. Preventing MRSA requires a combination of good hygiene practices and effective infection control measures.
One of the simplest and most effective ways to prevent MRSA is through regular hand washing. Washing hands thoroughly with soap and water for at least 20 seconds can remove bacteria and reduce the risk of transmission.
Proper wound care is also essential in preventing MRSA infections. This involves keeping cuts, scrapes, and other breaks in the skin clean and covered with a sterile bandage.
It is also important to avoid sharing personal items, such as towels, razors, and clothing, which can facilitate the spread of MRSA. In healthcare settings, strict infection control measures are necessary to prevent the spread of MRSA among patients and staff.
Awareness and education are key components of preventing MRSA. By working together, communities and healthcare providers can effectively combat MRSA and prevent its spread. Section 9. Conclusion, Awareness and Hygiene. In conclusion, MRSA is a formidable superbug that poses significant challenges to public health due to its resistance to many common antibiotics.
Understanding MRSA, from its symptoms and causes to the types of infections it can cause, is crucial for effective management and prevention.
Good hygiene practices such as regular hand washing and proper wound care are essential in preventing the spread of MRSA.
Public awareness and education are also vital in empowering individuals to take proactive steps in reducing the risk of MRSA infections.
Remember, maintaining good hygiene and being aware of the risks can go a long way in preventing MRSA and ensuring better health outcomes for all.